Human milk is the best form of nutrition for babies. That's why the decision to breastfeed after you return to work is well worth the effort. Good preparation can help make the transition go much more smoothly. Start the process early by talking to your supervisor before your baby arrives. Be sure to take advantage of the Affordable Care Act provisions that support breastfeeding in the workplace. And check out the U.S. Breastfeeding Committee for helpful information on this topic. You'll need several things to get started, beginning with a private room for pumping. This could be an office, a pump room, or a conference room, but not a bathroom. You can make almost any room work if it has a chair and an electrical outlet. Your supervisor can provide you with options. Timing is everything, even with pumping at work. Plan on 2 to 3 pumping breaks during an 8-hour workday. Each break will last 15 to 20 minutes. Discuss with your supervisor how these breaks can be worked into your schedule. If daycare is on site or nearby, consider breastfeeding your baby at lunch instead of pumping. You'll also need equipment. Choose your breast pump before your baby's birth and learn how to use it. Most moms choose an electric pump that allows them to pump both breasts at the same time. Look for a pump with a fast cycle speed and adjustable suction. For the first 2 weeks after your baby is born, just focus on getting comfortable with breastfeeding. You'll want to pump only to relieve engorgement. After 2 successful weeks of breastfeeding, start by adding a pumping session each day around the same time when you first wake up. The hormones that produce milk increase while you're sleeping, and most women produce the most milk shortly after waking. Feed your baby first, then pump. These initial sessions will help you become familiar with setting up your pump, learning which pump settings work best for you, and being able to relax while pumping. You can also begin storing milk in the freezer for use when you return to work. Store your milk in small quantities, no more than 2 ounces to each bottle or storage bag. Be sure to label the container with your baby's name, along with the date and time the milk was pumped. Use the oldest pump milk first when you begin using your frozen supply. Experiment with bottles and nipples until you learn which work best for your baby. When choosing nipples, look for newborn slow-flow nipples. These are usually easier for babies who are used to feeding from the breast. Faster flowing nipples can overwhelm your baby with too much milk too quickly. Some babies will take right to the bottle, while others may need a little convincing. It's not unusual for babies to take a bottle more readily from someone other than mom, since they already associate their mother with feeding at the breast. About a week before you return to work, schedule a practice day. Get up at the time you would normally go to work. Go through your morning routine, then take your baby for a half day with his care provider. Return home and follow your work schedule to determine if your pumping schedule will work for you and your baby. Compare the amount of milk you pumped to the amount taken by your baby. You may need to increase your pumping or work with your caregiver to avoid overfeeding. If you can, start back to work gradually so you and your baby can have time to adjust to your new schedules before you're faced with a full workload. Talk with your supervisor about options that may be available. Planning ahead and preparing the night before will make a big difference in your workday. A checklist can help simplify your life. The night before, place freezer packs, blue ice, for your pump bag into the freezer. If you will need milk from your freezer, move bottles to the refrigerator to begin thawing. Make sure your pump bag includes clean bottles with lids, enough for each pump session plus 1 extra. A pump kit with valves, membranes, flanges, connector, tubing. Having 1 kit for each pump session saves time. Maintaining your milk supply will be easier if you start out doing it right from the beginning. Attend breastfeeding classes at your birth hospital and start breastfeeding within the first hour after birth. If your baby's health prevents feeding, start pumping that first hour. Early feeding or pumping helps build the milk supply you'll need. As you start back to work, allow your baby to nurse as often as desired during the evening and at night. Many babies make up for time away from mom by nursing more often once you're at home. Nighttime feedings or pumping also help increase supply. If your freezer supply starts to dwindle, contact your lactation consultant for tips on increasing your supply. Becoming a working, pumping mom takes planning, effort, and patience, but the benefits and rewards are countless for both you and your baby. The lactation consultants at Children's of Alabama are here to help. You may reach them at 205-638-6600.